The findings indicate Ethan was experiencing depression, anger, and thoughts of harm that manifested in concerning behaviors, but did not trigger an effective involvement response. The interaction between Ethan's untreated mental illness, family dynamics, and access to unsecured firearms likely contributed to the tragic outcome. This case highlights the importance of addressing the psychological root causes through coordinated multi-sector prevention efforts focused on early identification, treatment, and limiting access to lethal means during times of crisis. With improved awareness and protocols, similar tragedies may potentially be avoided going forward. What are some potential strategies for improving mental health screening and treatment protocols in schools? Several strategies could help strengthen mental health screening and treatment protocols in schools. Implement universal mental health screenings for all students on a periodic basis using validated tools. Screenings can help identify students experiencing issues who may not otherwise come forward. Train teachers and staff to recognize warning signs of mental illness or distress, and ensure procedures are in place for appropriate referrals to mental health professionals, such as school counselors or psychologists, for further evaluation. Increase the number of mental health professionals available in schools through partnerships with community organizations. An appropriate student-to-counselor ratio is important for timely follow-up. Develop multidisciplinary threat assessment teams to evaluate high-risk students and coordinate treatment and safety plans involving parents, healthcare providers, and law enforcement as needed. Establish clear protocols for involuntary psychiatric evaluations or holds for students deemed in imminent danger to themselves or others due to severe mental illness. Provide mental health first aid and suicide prevention training for all school staff to recognize signs, engage effectively with at-risk students, and respond to mental health crises. Obtain parental consent for mental health treatment and information sharing with outside providers to facilitate coordinated comprehensive care. With enough resources and multi-sector coordination, schools can significantly improve early identification and intervention to help address the mental health needs of their students. How can schools implement these training programs on a widespread scale? There are a few key strategies schools can employ to implement mental health first aid or other similar training programs on a widespread scale. Secure dedicated funding streams. Schools should work with district/state level administrators to secure ongoing funding issues specifically for widespread staff mental health training. Possible funding sources include increased school budgets, grants, community partnerships. Develop multi-year rollout plans. Rather than one-off trainings, schools should create structured multi-year execution plans to systematically train all new and existing staff over time through regularly scheduled sessions. Combine into professional development. Mental health literacy training programs can be combined into existing professional development requirements to increase participation and normalization. This ensures new hires also complete training. Offer online hybrid options. In addition to in-person sessions, offering affordable online blended learning formats increases accessibility and allows staff to complete training on their own schedule. Form community partnerships. Coordinating with local mental health organizations, who often provide certified instructors, can help schools access training resources and potentially secure external funding. Provide continuing education credits. Awarding continuing education credits, such as those required for teaching relicensure, creates incentive for ongoing participation and skill building. With strategic planning and issue of resources, all school staff can complete evidence-based mental health literacy programs to better identify and support students in need. What are some potential challenges schools may face when implementing these training programs? There are a few potential challenges schools may face when implementing widespread mental health first aid or other training programs. Cost and funding constraints. As with any new initiative, securing enough ongoing funding can be difficult. Upfront and recurring costs associated with training instructor certification, materials, staff time, etc., require commitment of financial resources. Competing priorities and time constraints. With packed schedules and existing responsibilities, it can be challenging for administrators and teachers to prioritize initial and booster training. Support may be needed for coverage of teacher duties during sessions. Staff buy-in and participation. Not all staff may see mental health training as relevant to their role or prioritize it without motives. Schools must clearly communicate importance and benefits to promoting buy-in. Shortage of local instructors. In underserved areas, lack of certified trainers may create delays or backlogs for schools to access programming. Partnerships or online options could help address capacity issues. Implementation fidelity. With multi-component programs, schools must closely monitor rollout quality and fidelity to achieve intended outcomes. This requires infrastructure for coaching, evaluation, and troubleshooting. Stigma and lack of mental health literacy. Pre-existing stigma or lack of familiarity with mental health issues among some staff could reduce receptiveness to training. Normalization efforts are important. Proactive planning, additional resources, and community partnerships may help schools overcome these barriers to effective, widespread implementation of vital mental health training programs. Memorial services and tributes for the victims have brought the community together in mourning and remembrance. These solemn occasions serve as a reminder of the lives lost and the urgent need for collective efforts to prevent such tragedies in the future. Ongoing legal and community developments continue to unfold, with trials and sentencing drawing public attention. Meanwhile, local healing efforts aim to rebuild a sense of safety and normalcy, though the scars of the tragedy will undoubtedly linger for years to come. In the aftermath of the Ethan Crumbley shooting, the legal system took significant steps to address the tragedy. Trials and sentencing discussions began to unfold, scrutinizing every detail to ensure justice for the victims and their families. This process aimed not only at penalizing the perpetrator, but also at setting a precedent for handling similar cases in the future. Local healing efforts intensified as the community sought solace and strength. Programs and services were launched to support those affected, focusing on mental health, community cohesion, and resilience. These initiatives symbolized a collective determination to recover and rebuild in the face of adversity, marking a poignant chapter in Oxford's response to the tragedy. Thanks for watching, everyone. If you enjoyed this video, please hit that like button and subscribe for more awesome content. Don't forget to ring the bell so you won't miss any of our future videos.